Hi everybody, this is Dr. Sapp, where we're creating future nurses, and today we're going to discuss diabetes insipidus versus syndrome of inappropriate antidiuretic hormone, SIADH. So first of all, when we talk about these two diseases, we have to look at the ADH hormone, the antidiuretic hormone. So what is the antidiuretic hormone? Basically, in simple terms, the antidiuretic hormone helps control the amount of water and salt in the body. So it controls your blood pressure and how much urine is being made in the body. So first of all, when we talk about diabetes insipidus, do not confuse this with diabetes mellitus. They're not the same thing. So don't confuse the two. And I know a lot of students tend to confuse the two. They see the word diabetes and then want to answer it as if it's a diabetes mellitus question, but it's not the same. So with diabetes insipidus, we have a decreased amount of the antidiuretic hormone. Now the antidiuretic hormone is made by the hypothalamus and then it's stored in the pituitary gland until it's secreted. So it's secreted by the pituitary gland. So some things that could cause the antidiuretic hormone to be decreased in the body, maybe you have brain tumors or some type of head injury or a central nervous system infection of some type or something like that. With the pituitary gland being impacted, then you don't create enough of the antidiuretic hormone, which is going to cause the body to produce copious, large amounts of urine because you don't have that antidiuretic hormone to stop you from urinating. So you're just going to urinate constantly. So it's going to be copious amounts of diluted urine that the body's going to be putting out. So think back to, remember our video on fluid volume deficit. So that producing those copious amounts of urine in the body are going to produce all the signs and symptoms of fluid volume deficit or dehydration, right? So remember the polydipsia, which is excessive thirst, because you're becoming dehydrated, weight loss, decreased blood pressure. Remember we said the fluid volume in the body will control which way the blood pressure will go. So if the fluid volume in the body is going down, then the blood pressure is going to go down as well. Heart rate's going to go up. The person's going to start to have weight loss. Remember we talked about poor skin turgor. So remember the skin's not as elastic, so when you pull it up, it doesn't bounce back like it should. Also dry mucous membranes because you're losing fluid. Constipation also is a sign of dehydration or decreased fluid volume in the body. The person could be weak, fatigued because they're losing all this fluid. Diuresis, remember we said urinating a lot, so polyuria. Constipation, if the situation is not treated properly, then the person could go into hypovolemic shock and start experiencing signs and symptoms of shock. And so some of the signs and symptoms of shock could be the cool, clammy skin, again, the blood pressure going down, the heart rate going up, rapid breathing, nausea, vomiting. All those could be some signs that they could be going into shock. So how are we going to treat this? Obviously, they're losing all this fluid, so we need to do something that's going to, stop the fluid loss. So they're going to need hormone replacement, replacing that antidiuretic hormone. And depending on the cause of it, it might be a permanent replacement that they needed, for the rest of their lives. Replacing the fluid and electrolytes. Electrolytes are going to be off as well. So replacing fluid and electrolytes. So we're going to encourage oral fluid intake. However, they're going to be losing so much fluid that the oral intake is probably not going to be enough, and they're going to need IV fluids as well. Nursing management, we want to maintain fluid and electrolyte balance. Get a baseline vital signs, because remember we said their blood pressure is going to be down, their heart rate is going to be up. So we want to get a baseline vital signs and making sure we're monitoring those vital signs like we need to, and monitoring the weight, because their weight is going to decrease because they're losing so much fluid. So remember when we talked about in our fluid volume videos how to monitor weight. you want to monitor their weight every day, in the morning, after they urinate, before they eat, same amount of clothes, same scale if possible, so that we can make sure we're getting an accurate weight on these individuals. And then strict intake and output. So we want to do strict intake and output to make sure the amount of fluid that they're putting out is starting to decrease. So we want to make sure we're monitoring that appropriately. Okay? Now let's take a look at SIADH. Okay, so syndrome of inappropriate antidiuretic hormone, or SIADH. That's the opposite of diabetes insipidus. So remember we said with diabetes insipidus, their amount of ADH hormone is decreased. Well, in SIADH, the amount of the ADH hormone is increased. So they have excessive amounts of the ADH hormone, which is causing the opposite effect, which is causing fluid retention or fluid volume overload in these individuals. So some possible causes, maybe the person could have malignancies or tumors that's pressing on that pituitary gland and causing them to have these increased levels of the ADH hormone in the body. So if we're having fluid volume excess or fluid volume retention, remember back to our fluid volume excess video, things that you might see in that person. So remember, the blood pressure is going to follow the fluid volume. So if the fluid volume in the body is increasing, the blood pressure is going to increase as well, right? Weight gain. The distended neck veins are a possibility, with this one. Confusion, seizures, loss of consciousness. So think about if fluid is building up on the brain, right? You need to monitor that level of consciousness too, right? They could have crackles in the lungs if you got fluid volume building up in the lungs. They could have edema, so you need to check edema in the extremities. Their urine output is going to be decreased because they're going to be retaining all of this fluid, right? Weakness, right? These are all some signs and symptoms of fluid volume excess. So treatment and nursing management. Obviously, we don't want to keep putting in a lot of fluids into the body when they're already retaining excessive amounts of fluids. So we're going to restrict their fluid intake. Probably, depending on how bad it is, we could restrict it to 500 to 1,000 mLs a day because they're already retaining fluid. They may need some diuretics as well to help excrete some of that fluid off the body. Monitor their cardiovascular and neurologic systems as well. So level of consciousness. Remember, level of consciousness is going to be your first indicator of brain function. So if I have fluid building up in the brain, then my level of consciousness could be altered. So when I say altered level of consciousness, I could be going in and out of consciousness. It could be a change in my mental status. It could be that I'm getting more anxious or having anxiety. But there's some change in my level of consciousness or my mental status. That's going to be your first indicator of brain function as well. Is the heart working too fast? What's that going to be like? So we're going to monitor cardiovascular status as well. Remember I said you could also have crackles in the lungs. So assessing lungs as well. Monitoring your electrolytes. And then monitoring your daily weights. Again, remember how we said to do the daily weights in the morning, before you eat, after you urinate, same amount of clothes, same scale if possible, so that you can get an accurate reading or accurate reading of what your patient's weight might be. Okay, so that wraps up our video on diabetes insipidus and syndrome of inappropriate antidiuretic hormone, or SIADH. If you like this video and you'd like to see more videos like it, then please consider subscribing to my YouTube channel. Thank you and have a great day.